Good evening, everyone. I'm Lissy Bastian. It's Wednesday, March 11th. It's great having you back with us. It's now a pandemic, and that's COVID-19, formerly known as the coronavirus. The coronavirus was detected back in December last year when Chinese officials reported to the World Health Organization country office in China that a pneumonia of unknown cause was detected in Wuhan City in the Hubei province. On January 30th, Director General of WHO, Dr. Tedros Adhanom Ghebreyesus, declared the outbreak a public health emergency of international concern as the virus had spread outside of that province and outside of China. Dr. Tedros, in a media briefing today, announced that in the past 2 weeks, the number of cases of COVID-19 had increased 13-fold and the number of affected countries had tripled. Now, more than 4,300 persons to date have lost their lives and more than 121,000 cases have been confirmed in 114 countries. 81 countries do not have any confirmed cases and 57 countries have 10 or fewer cases. According to the WHO director, in the days and weeks ahead, it's expected to see those numbers increase. The WHO has been assessing this outbreak around the clock, with Dr. Tedros adding that the organization is deeply concerned by both the alarming levels of spread and severity, as well as by the alarming levels of inaction. Based on the WHO's assessment, COVID-19 has been characterized as a pandemic. Now, Dr. Tedros says describing the situation as a pandemic does not change the WHO's assessment of the threat posed by the virus, and it does not change what WHO is doing and what countries should do. He added that the organization has never seen a pandemic sparked by a coronavirus and says it has never seen a pandemic that cannot be controlled. The WHO says they have made the call every day for countries to take urgent and aggressive action. Meantime, 41 states in the U.S. have confirmed cases of COVID-19 with a total of 1,077 cases and 31 deaths. There are 4 Caribbean countries that have reported cases, including Jamaica, Dominican Republic, St. Barth, and French Guiana. The last time the WHO declared a pandemic was in 2009, when the H1N1 flu had an outbreak. Now, what does this mean for the Bahamas? And are we ready for this likelihood of this virus? Well, Health Minister Dr. Dwayne Sands, while speaking at a meeting with the Bahamas Christian Council and other members of the community, said this.
Are we ready in the Bahamas? No country can say that they are absolutely 100% satisfied that their level of preparation is complete. We have been working at this very aggressively from January, and we have created a health plan which has been widely disseminated.
Dr. Sands reaffirmed that there are no confirmed or suspected cases of the coronavirus in the Commonwealth of the Bahamas and that there is no need for panic.
It is important for us because you are going to be asked to minister to people who either are afraid or who are actually infected. So what do? You wash your hands. You carry a bottle of sanitizer if you can find it. Okay? And you be very careful about your social distancing. Do I think you need to wear a mask? No. Okay? But if somebody is obviously ill, you're going to have to figure out how you're going to modify your approach. But again, bear in mind that you have far greater risks from other diseases than you do of COVID, even on the 11th of March 2020.
Although there have still been no confirmed cases, the Ministry of Health is making the necessary preparations for when, not if, the first case of the virus is confirmed. A 6-bed facility will be built on the compound of the Princess Margaret Hospital, significant ways from the general hospital population, and a 20-bed facility on the Royal Bahamas Defense Force property. These 2 compounds are currently under construction. Dr. Sands also says that every clinic in the Family Island has identified an isolation room in the scenario that any cases are confirmed on the out islands. Dr. Sands advises that people regularly wash their hands, sanitize, and avoid touching their faces, especially after greeting someone. Some degree of social distancing should also take place, Dr. Sands added. advising that people should elbow bump or fist bump in lieu of hugging. Well, Dr. Sands also met with straw market vendors today to answer questions, concerns, give updates, and to ease the minds of vendors of the coronavirus pandemic. The vendors, who work very intimately with tourists who come freshly off cruise ships, have expressed their concerns about being exposed to the virus, prompting Dr. Sands to hold this meeting.
Every time a cruise ship comes in, they are mandated to provide an international maritime declaration. And that declaration has to state if there's anybody sick on the ship, what they're sick with, and so on and so forth. Okay? Our public health team will then get that international maritime declaration, and if they feel it is necessary, they will then board the ship, make sure before they let those persons off that ship to come into your straw market. Captain's office. The airlines, we've done the same thing.
Dr. Sands also addressed the risks involved if one was to contract COVID-19, his statistics being based on cases of people who have actually been infected. No one under the age of 9 years old has succumbed to the disease, Dr. Sands says. Children between the ages of 10 and 19 have a 1 in 500 chance of dying. Between 20 and 29, a 1 in 500. And between 30 and 39, the risk increases to 1 in 250 people. People over 60 have a 3.5% chance of dying from the disease, and people over 80 years of age have a 15% chance. Dr. Sands made the comparison that more people have died from measles and HIV than from COVID-19 since the start of 2020. Dr. Sands assured the vendors that the Ministry of Health has nothing to hide, will be honest with the public, and will release all information given to them as the COVID-19 situation changes. As the World Health Organization has declared the COVID-19 as a pandemic, Prime Minister Dr. Hubert Minnis is encouraging Bahamians not to panic, but to go on with everyday lives. However, he says to take the necessary steps to prepare and protect yourselves from this virus.
Reassure the Bahamian populace that there are no cases of coronavirus recorded here, and they must continue with their normal life. However, still take all the necessary precautions in terms of the hygienic.
Now, over the last several days, health officials have been sharing their plans to prepare for in the event the virus reaches our shores. Dr. Minnis says he is very satisfied with plans that have been put in place by the Ministry of Health, adding that he has met with personnel from the National Committee who has given proposals or ideas to help combat the virus.
Very satisfied. As a matter of fact, I've had a meeting just this morning. You would have heard me spoken earlier that we were putting together a national committee. I met with that national committee this morning, and they would have put their proposals, ideas, etc. We discussed the coronavirus.
Deputy Prime Minister and Minister of Finance Peter Turnquest, weighing in on COVID-19 from a financial standpoint, is encouraging Bahamians to take the necessary steps and prepare financially for the long term as COVID-19 continues to evolve on an hourly basis.
Right now, we're living in a very uncertain time. As the World Health Organization has just announced this virus as a pandemic, we don't know what that's going to mean in the long term. So certainly we ought to be prudent about our expenditure, ensure that we engage in those things that are going to bring us long-term benefit.
Meantime, the Minister of Education announcing in the House of Assembly today what his ministry's plans are in the event of the threat of COVID-19 or coronavirus in public schools throughout the Bahamas. With the threat that coronavirus could reach the Bahamas being high since 9 cases of the virus have been confirmed in the Caribbean, which elevated that threat to high, Education Minister Jeffrey Lloyd says the ministry has advised schools of what preventative actions should be taken to reduce the spread of respiratory viruses. But the ministry's steps are not new, according to Minister Lloyd, who says protocols have been in place for years with regards to outbreaks, as in recent times there have been outbreaks of scabies, tuberculosis, and bad strains of the flu.
Such as, number one, to verify that such a condition may exist in the school by informing the school's nurse, if a nurse is available, and that nurse will call the relevant authority to verify. And if no nurse is available, then to contact the nearest clinic and inform that clinic of the situation. If a case is verified, step 2, that the nurse is to assist in getting the health team to the campus, meaning the Ministry of Health team. Where there is no nurse, the principal will assign an administrator to call the nearest clinic. Inform the director of education, the deputy director for schools management, who will then inform the minister. Call a meeting of the administrators and shop stewards with the nurse or someone from the clinic present. And let that nurse or someone from the clinic inform them of the case and allow them to state the protocols and inform the health official of what is next to be done.
Minister Lloyd says that a circular has been issued to all district superintendents, principals of all government schools, headquarters staff, heads of all satellite offices, presidents of the Bahamas Union of Teachers and the Bahamas Educators Managerial Union, entitled Coronavirus Alert. In that, the minister says information was provided about the nature of the virus as well as what preventative actions can be taken.
Wash your hands with soap and water for at least 20 seconds. Use an alcohol-based sanitizer that contains at least 60% alcohol if soap and water are not available. Avoid touching eyes, ears, nose, and mouth with unwashed hands. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing, sneezing. Cover your mouth and nose when sneezing and coughing, and clean and disinfect frequently touched objects and surfaces. Among the updates include those who may now suffer any of such symptoms, meaning teachers, students, administrators, janitorial staff, are to remain at home until they have been released by medical facility or practitioner.
Minister Lloyd says the circular will be updated and delivered to all stakeholders within a 24-hour period. The minister added that they have advised all stakeholders to stay informed and pay close attention to official news sources, which is the Ministry of Health. You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.